All right, going to call the meeting to order at 5:01 and roll call, please. Ms. Gattuso.
Mr. Lee,
Present.
Ms. Moran, Mr. Munoz,
Yes.
Ms. Smith,
Yes.
Ms. Valadeo,
Here.
Mr. Pereira,
Here.
and I am here.
All right. Pledge allegiance. Great salute.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, anything to change or add on the agenda, Mark?
No.
Need a motion to approve the agenda as presented.
I'll go ahead and approve the agenda.
I'll second.
Got a motion by Member Munoz, seconded by Member Valadeo to approve the agenda as presented. All those in favor?
Aye.
Opposed? And it is covered. On to next item, which is public hearing. Is there anybody here that wishes to address the board on any item on today's agenda? All right, seeing no one come forward, we'll move on to new business, personnel actions. Dr. Marshall?
All right, I sent you all an email, just basically relative to Pacheco High School and the changes that happened there with the promotion of Dr. Sutton. This is an expeditious basis so that the schools can start off with their leadership in place when school starts. As I said in the email, it's an interim appointment, and I think I was pretty detailed with all that.
Good idea. You guys got creative. Good idea.
Anthony, I didn't put on there that we need a motion and stuff on the agenda, but we need to approve the personnel action. I didn't write on the agenda.
Oh, yeah, I was going to, yes, yeah. Not a problem. All right, any questions or comments? Motion, please.
I move we accept the report for the certificate of employment.
Got a motion by Member Gattuso, seconded by Member Smith to accept or approve the report for certificated employment. All those in favor?
Aye.
Opposed? And it is carried unanimously. All right, on to our study session. CBT, you're on.
Do you want to?
She's not going to be here. She's not going to be here today.
Oh, so she can't have a copy?
Oh, yeah, she can have it. Yeah, but I don't.
I'll see her on Friday after the other two.
Sorry.
Good afternoon. I'd like to thank Dr. Marshall and the Board of Trustees for having us out today. I'm Tierney O'Brien with California's Value Trust, CDT. With me today, I have Anthony Pulliam, who is our Director of Business Development, and also Rosa Soria. She serves as the assigned account manager for currently LBTA, but if the trustees were to move forward, she would also be the assigned account manager to support the transition of the trustee group to CBT. So in the absence of technology, we did bring paper copies of the presentation. Just a little agenda on what to expect today. We want this to make this a meeting for you to ask any questions you have of us. We have, a guide to kind of walk through who CBT is, our structure as a joint management trust fund. We'll go over the plan specifics. We'll do a high-level overview between plans that are available and offered to you through CISC, your current plan administrator, to plans that are going to be made available that mirror what LBTA offers. There are a few transitional questions. I know there was questions about the network of providers to access. We'll touch on that. And then we have probably more time than you would want to spend with us. We could talk about CBT for hours and hours. But we want to make this meeting meaningful. So if you want us to pause and address something at that time, we're flexible on how you want this meeting to go. So starting off CBT, we're happy to celebrate our 40th year this year. We were formed in 1984. We are, as Mr. Pereira referenced, we are a not-for-profit trust fund that provides benefits to school districts, community colleges, county office of ed, and also the California School Employees Association union staff. So we strictly serve the educational business and the supporting union for classified employees. We are self-funded for our PPO products, which those would be the plans, the types of plans that would be offered to trustees if you were to onboard with CBT. And we do run on single-year contracts. There's no long-term commitment or lock-in that we would require for any group, district, employee group, trustee group to remain in CBT. And one of the benefits with CBT is that there's no buyout to get out of that single year contract. All of the premiums collected go to pay claims, and we forecast that if a group were ever to leave CBT, we would never come back to a district or a chapter or an employee group to say, oh, we didn't collect enough in revenue, you need to pay out what's called a run out or claims liability. So that does provide you protection in the employee group or the trustee group here, that the rates are 1 year, and the rates we do have in the presentation for you today and in the packet, and we can kind of talk through, we have some examples as it applies to your contribution that Los Banos Unified pays for trustees for that contribution level. So we talk about that. But we really do exist to serve school business. Our mission is, to provide our member districts and employee groups the best possible plan design options at the most affordable price. We know that healthcare inflation is climbing. It doesn't really matter where you buy your benefits. It is a national challenge that, healthcare inflation is going up and up. But being that we are a trust fund where the sole participant is the sole benefit is the member focus, that's where we feel that we strive to provide excellent options of coverage, our customer service. We have groups returning back to CBT because of our service, and the breadth of programs and resources that go beyond just the insurance card you carry in your wallet or on your phone. So a jointly managed trust, so California's valued trust, the word trust is we are a jointly managed trust, which means we're governed by equal representation of management board members and labor members that make decisions on behalf of CBT. And how that trickles down into the employee groups is that, and this is more specific just to kind of level set for a group like LBTA, where LBTA is an equal contract signer with CBT along with the district. So it's a three-way contract. So every decision that is made has to be agreed upon between the collective bargaining, the association president or a designee and the administrative superintendent cabinet for our decisions. For a non-represented group, such as management or a trustee group, the sole contract signer would be administration, so Dr. Marshall or an appointee of his. So our rates are distributed each May. We know our renewal in May for an October 1 effective date. So we communicate our rates several months in advance to allow our districts that are prospects, our employee groups that are prospects outside districts looking at CBT, and then it gives time for our existing districts and employee groups to make decisions of, do they want to remain with CBT? Do they want to adjust their plan benefit menu? Because CBT, we have a large list of plan options. We'll go through some of the ones that will be specific to this group here. So there's a lot of just transparency in people knowing, our groups knowing what our rates will be. And we give timely notice for people to make adjustments of retaining with CBT, adjusting their plan menu, or if they were to depart CBT. Administrative support. So we do handle all of the administration of the plan benefits. So currently with LBTA participating in CBT, we work solely with your district office staff to handle all of the onboarding of new hires in terms of enrolling in their insurance. If an employee has a qualifying event, say they get married, they have a baby, that is their unique time to make a decision on do they add their spouse, What does that cost? What plan design? So we handle all of that operational function. We don't outsource that to someone else or refer the member to, say, Anthem Blue Cross or Blue Shield or Delta Dental. We handle all of that service level inside the CVT organization. Down to the level of, so Rosa's here today representing account management. She has a relationship with LBTA president, the district office on the overall support of the operations and offering the benefits. And then internally there is Michelle Bugg. She couldn't be here with us today. She is the assigned member services representative that really works with the day-to-day operations of CVT. We handle the COBRA administration. Oftentimes organizations will send out that to another organization. That's all part of being a CVT member. It's not parsed out to another person or another entity. And that goes also for retirees that aren't receiving a district contribution. District stops paying, or maybe perhaps the retiree didn't qualify, they didn't work enough years to receive retiree benefits. We allow retirees to pay us directly once they fall out of the scope of being under the district benefits. And that is all handled in-house that's part of our value prop to the employer, which is the school district. We have an online eligibility enrollment system. If ever you know a CVT member, once upon a time the trustees were in CVT. LBTA has been a CVT member since 1988, and actually the entire district was with CVT back in 1988. And then around 2012, that's when classified management and trustees made the decision to go to CISC. So there has been that separation, but we've evolved since, if any of you have had CVT anytime, long triplicate enrollment form where somebody had to hand write in all of their eligibility. That is all now transitioned to be online, where the employee or the trustee would have on-demand access to enroll in their benefits, with an option for paper for someone that might not have the technology to, or the capability or skill set, or we work with our members to make sure that they have enrollment by the effective date. But my CVT has saved time administratively for your district office, but it also provides currently the teachers the ability to conduct open enrollment at a time and place of their convenience, where they don't have to drive their enrollment form to the district office to drop off. So it is a more efficient way to get into your benefits and get into your benefit plan faster. I'll pause right there if there's any questions related to kind of the infrastructure before we jump into the actual, I'll talk about some of our rate history and talk about the plans and kind of the nuts and bolts of the benefits. Okay, so put together an average rate history. This just documents on paper the last 8 years of our rate increases. If you added the years before, it bumped it up to about a 4% with our renewals. That is, you can see, even with healthcare inflation, we have had steady renewals that, there has been some ups and downs with the, overall percentage. Not knowing a full comparison, I'm sure if you looked at us this year rate history or others, you may see fluctuations of years. We set our rates based on a time period of utilization and what it costs to provide. So claims come in to the trust, and then claims are out to paid trust, and we forecast what we need to pay claims for the upcoming year. So our recent renewal, so we communicated in May that specifically for Los Banos Teachers Association, that's the current district or current bargaining unit in force with CVT, that they were to receive a 5% increase for the upcoming October rates. So our plan year runs alongside parallel with CISC, your current administrator, which is October 1 through September 30th. You can only join CVT, well, we allow districts and groups to join anytime during the year, but it does need to line up with the departure date of your current administrator. So CISC and CVT, we run parallel with our plan year, which is October 1. So we do want to have notice if there is a level of interest in moving forward with CVT. Around August to have the best, August 1st, no later than August 10th, 15th is pushing it to ensure that you have your ID card in hand by the effective date October 1. You'll see on the slide below Anthem Blue Cross. So currently in CISC, you are under the medical network of the medical carrier of Blue Shield of California. CVT, we also offer Blue Shield California to many of our districts, but there are some no-compete rules, so to speak, where there's something called blue on blue. So if you have any insurance experience, they don't let you go Blue Shield to Blue Shield. You have to go from Blue Shield to another carrier if you're going to make that move. So CVT, because we've had to figure out a way to adapt because we've wanted groups to come in. There's interesting dynamics when you leave Anthem. Anthem's rule is you have to go Anthem to Anthem. So it's very complex in the medical network carriers. So the network that we are able to offer to trustees would be Anthem Blue Cross. Mr. Pereira had asked that we give a link that helps this group identify and confirm that any doctors, facilities, hospitals are in the network. Anthem is a larger network nationally, and oftentimes in most areas of the state, it is a pretty parallel match for network of providers. So all your major hospitals, the medical groups, I would encourage you, if you're seeing, any type of, do the homework to know as you're making your decision, all the providers that you, and if you cover a dependent, the providers that you use, and provider includes everything from specialists to primary care doctors. The hospital system, of course, is in network, and then being in a PPO, you have the ability to self-refer out to different parts of the state and even nationally. That's just something that we encourage you to evaluate as you're making your decision, is the network. But Anthem, the teachers are on Anthem. We don't hear that there's a gap in care related to provider access. So the plans, a little bit about the underwriting process. So when a prospective group or district looks at, is it interested in CVT, we do an actuarial evaluation of that group to see how they would line up to our current risk pool. So because we have the teachers in force with CVT, and this group is fairly small, with just this audience looking, our underwriting approved that we can extend the same plan options and rates currently offered to the teachers, to LBTA. So we lined up, and it's, I will speak to CISC benefits. I don't know every single line item of the CISC document. It's always homework that we can take back. But really we matched up as close to the plans that you have offered under CISC to what the most current or comparable LBTA plan is. So the CISC Blue Shield products, they offer several versions of 100% plan. If we line up our PPO plan 1A, you will see the key categories I'll refer you to is that individual family deductible, coinsurance is the third box, medical out-of-pocket maximum, RX, which is pharmacy out-of-pocket maximum, and then you can just see the different categories of care depending on what plan you were on. And I'd refer you to, I would ask the question, if you know what plan you're on, we can dig deeper into this if you have specifics. Really just taking a look at, for most of the different categories of benefits, CVT provides a equal or better level of coverage. I'll point out that if you look at the medical out-of-pocket maximum, which is the 4th and 5th line, you'll see two different dollar amounts. You'll see $1,000 individual, $3,000 family, that's what that means, one, and then down below is the pharmacy. So you have 2 out-of-pocket maximums. As you're going, you're paying your copay, you're paying your deductible. CISC is tracking your medical in a bucket, and they're tracking your pharmacy copays in a bucket. CBT, we combine that bucket of money to you have 1 out-of-pocket. It's called a combined out-of-pocket maximum. So that is a benefit for CBT. If you look at ours is $1,250, and this is specific to the 100% plan. There are a few copay differentials when someone goes to a hospital over Quest or LabCorp, or the provider, the lab or X-ray department in their medical group. There are a little bit higher copays for access to care there. Our ER copay is a little bit higher at $150. That's just, I would say we're under the market, both CBT and CISC, where the average ER copay is running between $200 and $500 now if you look in the industry. And then specific to the pharmacy, we kind of align with the generic versus brand prescription copays. And we'll touch on the pharmacy, on our pharmacy coverage in just a moment here. So we could go as deep or as wide on this topic here, but just know that we have a plan comparable to what you have available under your current benefits with CISC.
And this is small, but I'll add that in the second packet that's in your folder, we have the full benefit summaries that are outlined in there. So we can always refer back to those because the print's a little small on the printout. But
question.
Yes.
Prescription drugs, second from the bottom, under Anthem Blue Cross. I don't see Costco listed there.
Costco is an option under the network of pharmacies through CVS. So backing up, CISC uses Navitus for their PBM or Pharmacy Benefits Manager. We use CVS Caremark. So Costco is in the network for CVS Caremark as an option to access your prescription drugs. The one difference is Costco at CISC provides $0 for generics. We do not have that function. We don't have that copay option under Costco.
So it's $5 instead of
It would be $5 for generic if you were to select plan 1. However, if you used for a maintenance type medication, you could use CVS pharmacies, which includes your Target here, Costco, Kroger, which isn't in really this area here, Kroger grocery chains. That's where you can get a 90-day supply at 2 times the copay. So there is an incentive to use Target or Costco or even the mail order, but we don't have that free generic option. But I know there are some preventive medications, and if the cost of the drug is less than $5, I'm on an antibiotic. If you see my boot, I had an injury. I paid $2.16 for 12 days of antibiotics picking up at CVS. So they cost lesser than the $5 at the clinic.
I'm thinking specifically when you have diabetics, insulin costs that right now are $35.
35? So if it was a brand name drug, it would be $22. So we do fill with generics first. So if there's a generic equivalent first, and CISC has similar rules to that. If it's a drug you want to share offline, we could look up that drug and tell you where that would fall. And if it's a drug that requires maybe pre-authorization, because there is some changes in all the diabetic medications around the GLP-1 category. So that's your Jardiance, Ozempic, Manjaro. Yes.
I'll take some of that.
It is available. It just requires prior authorization for that. And also on the weight loss medications, we have some requirements as well. So we can talk offline if you have any specifics.
Yeah, my wife is on all that stuff.
Okay,
yeah.
so maybe that's a conversation we can have separately.
So just quickly, and you mentioned the 90-day Costco, I get prescriptions for 90 days that cost me nothing. So how much would it be now for 90 days?
90 days at Costco would be $10 for generic for 90 days.
Okay.
$44 for any brand name drug.
Okay.
Unless it is a prescription that falls under the preventive care or it's less than the $10 cost for that medication. Providing the premiums, so in this, and we have the full rate sheets in the packet, effective October 1, the premiums available to the plans that are all outlined here and in the packet are listed on the left-hand side. These are the monthly costs that we would bill to the district for anyone enrolled in this level of coverage. So, and then the dental plan, we lined up to the current benefits that you have available through Delta Dental. And then we also offer VSP as our vision provider. And then factoring in your $24,000 annual cap, which is $2,000 monthly, we outlined and calculated what the monthly out-of-pocket would be with dental and vision. And these, again, are the rates that are currently communicated and out for LBTA, who is currently in open enrollment right now.
And I'll add too that if you are on a plan that you currently have a deductible with CIS, coming into CBT, we would give credit for any deductible that's already been met. So your deductibles always start January 1. So on your current CIS plan, if you've already had some contribution that's gone towards that deductible, if you choose to come into CBT and choose a plan with a deductible, then we'll be able to give you credit for that deductible that's been met. You won't have to start back at zero. And then we also offer what we call our fourth quarter deductible carryover, which means that if you continue on into a CBT plan that has a deductible each year, anything that's contributed to that deductible from October 1st through December 31st, we'll roll that over to the next January 1. And that we simply do that because, you know, we're renewing on a 10-1. And so let's say, you know, someone picks their plan and, you know, in November they go skiing and they have an accident and they haven't had anything contribute to their deductible all year long, and then now they meet their deductible. We'll carry that over for them and give them credit on January 1, so you're not having to start right back at zero in a month and a half or a couple months. So that's just something that happens every year, you know, and it's any amount. So I mean, it could be a couple dollars, right? It's just that fourth quarter period. But definitely you will get credit for what's already been met coming in, and then each year we do that fourth quarter deductible carryover.
So we actually do work with CIS or another administrator where we share data. They would send us a list of where you're at with your deductible, and then we load that into your Anthem profile for 10-1. Any questions on premiums? And we have it zero. Obviously that would be zero out of pocket for the trustee. And this is a composite rate, so whether you cover yourself or any number of eligible dependents, the rate is the same, which is what you have currently available. The zeros here, and if someone chose a plan less than plan, if it's under the cap, that is just savings to the district. Transitioning from operations premium, want to talk about some of the value of CBT. Again, I mentioned at the beginning some of the things that go beyond just the card you carry in your wallet. Our relationship with Anthem Blue Cross has been long-standing. It was one of the first carriers that we offered when CBT started in 1984. It is what your teachers have now. It is what former classified and trustees and management had. But we've worked with Anthem to partner in capabilities that provide digital resources for our members, and also navigators over the phone or chat or text option. So that Sydney Health, Sydney is Anthem's app name. It's the little icon, looks like a little penguin on the App Store. But this is the digital resource for our members to access finding providers, checking explanation of benefits, that EOB that you get after your point of service, claim information. There's a virtual care option for someone that, you know, if they don't have a primary care physician or their doctor's booking months out and you need care now. That's a good resource to use the virtual care. There's a chat function, there's syncing with your fitness trackers. And then we're going to talk about some other benefits that all kind of live under that door of the Sydney app. But not everybody is in a digital space or prefers to have that live conversation. That's where our Anthem Health Guides come in. We have Michelle and our robust member services team. Rosa, of course, is here in person that, really can help with the infrastructure, but we don't have insight to anything on authorization of claims. Any billing questions. Is this surgery approved? I have questions on, is this type of procedure covered? Anything related to claim, utilization, finding a provider. We sent you the link to find a provider, but maybe you needed a little bit of extra step in finding a primary care physician because maybe yours retired or moved out of the area and you need to know who's accepting new appointments. Those health guides or navigators are kind of your shepherd to getting you the answers related to your Anthem coverage. So 2 different ways to allow our members to get answers to their questions related to their medical care. Just a quick note on the virtual primary care. We do have another telemedicine benefit that you offer, MD Live, I'll get into it just a second. But the virtual primary care allows you to get preventive care, screenings, cancer screenings. They'll give you a script to have a colonoscopy or a mammogram. It's really in the absence of someone having a brick and mortar relationship with a primary care physician or delayed access to care because you can't get in for a timely that works for you, the virtual care is a resource to use through Anthem. Coming back to CVS Caremark, I mentioned CISC use Navitus, we use CVS Caremark. CVS Caremark, 68,000 national pharmacies across, it's a very robust network of pharmacies. So it's all the major drugstore chains, including Walgreens, Costco, Walmart, Target. I don't think Rite Aid's really, there's Rite Aid is struggling. Independent pharmacies all fall under the CVS Caremark brand. The maintenance choice was what I was speaking to. If you take a maintenance type medication, you'll get that discounted. You'll pay only 2 copays instead of 3 for a 90-day supply if you use Target, Costco, or the CVS mail order program. You do have the ability that, say you really are endeared to your pharmacist at Walgreens and you want to pick up your maintenance medication there, or I forget the name of the drugstore. Is it still open here?
It's
okay.
not.
Okay, well, when it was, they were under this, they were in network.
But there is another independent, smaller pharmacy in town,
There is.
next to Apex, yeah.
I would guess, or we can confirm that they accept the CVS Caremark. It's really when you get down to like some of the compounding, holistic type pharmaceutical. There's one in Fresno that they do compounding and supplements and whatnot that you have to pay and then they'll reimburse under that. But so maintenance choice.
So some compounds, they will?
They're very limited in the compounding drugs that are covered. There's just key components because it's considered not FDA approved.
Right.
Only the FDA approved components of the compounding would be covered, but it requires the member or the patient to pay up front and then submit the line item of all the medications in a compound. But we can get into more detail on that because it's a very complex space with compounded medications. So CVS, they have, we know CVS for their retail drugstores, that they are also the pharmacy and Target. We would work with you to what we call Fast Start. That's just transitioning your prescriptions over to from Navitus to CVS for coverage on 10/1.
What about the pharmacy at Walmart?
It is a network.
They are?
And Walgreens. I know CISC is not.
I think Walgreens is closing down and wants to be on the site here.
Oh.
Who is?
Right
Walgreens.
Really?
That's what I was told.
That's unfortunate. I did put a slide in, or we put a slide in here on specialty pharmacy. So only to call out that there are certain medications that are used to treat cancer. So oncology medications that are autoimmune. So you think your MS drugs, your arthritis, lupus medications that are usually an injectable. They have to be temperature controlled. They're drugs that are sitting in the thousands to tens of thousands of dollars per month. We've moved to the CVS specialty pharmacy because it's not just going and picking up that prescription. It is really coordinating the care to make sure that that member is going to be able to receive that medication at a time and place where it's not going to sit on somebody's porch in Los Banos. And today's it's not that warm, but on a day where it's 110 and it's a $25,000 oncology medication, there's really coordinated care of the logistics. They make sure that the specialty pharmacy will work with the prescriber, the doctor or the specialist, on is this person still on the right dosage? Their dosage hasn't changed. They're not exhibiting side effects that they're going to maybe change the drug before they pull the trigger to fill the $25,000 med. They're really coordinating that that person is still on the right medication and the right dosage. So it's a little bit more handled in a special way. It has to go through CVS specialty pharmacy, which is either mail order or it gives you the ability to pick up that medication at the CVS Target store. Going into a little bit more of the programs, Carum Health is a benefit that is also offered at CISC. CVT, we offer a little bit more robust platform of Carum, where we have, so Carum Health is a voluntary center of excellence surgical benefit for our members. So access to care at a center of excellence in a timely manner for the patient is really where the Carum Health program steps in, takes that member that needs a musculoskeletal surgery, joint replacement, bariatric, cardiac, spinal surgery, encourages them to work with the Carum network, send them to a surgeon at a center of excellence. You'll see just some brand awareness for Stanford, Scripps, some of the sports medicine providers. City of Hope is a big oncology facility. This is a benefit where when a member goes voluntarily, outreaches to Carum, uses Carum for that center of excellence, they waive all their cost share, no deductible, no out of pocket, and they pay a travel benefit for the member and a companion. This is a voluntary benefit, but it is a benefit that you have a more dedicated navigator to get your surgery done faster at a facility that has good outcomes with a surgeon that does multiple of these procedures, not just one or two at the local hospital. So a big initiative for CVT is member awareness on this.
Yes, CVT, is it connected to Stanford?
Stanford is one of our network.
Network.
Stanford is in the Anthem Blue Cross network.
Okay, great.
I know right now they are not in the Blue Shield network. There is a network dispute between Stanford.
Just got a letter.
Yes, we are communicating to our Blue Shield members that Stanford is currently in a contract dispute with Blue Shield. Of course, if you've been in CISC for a while, these are just things that the hospital systems are doing to recoup cost, pay for the cost of the infrastructure to run a hospital. So it'll happen with Anthem in a few years. It just is something that happens with Sutter, Stanford, Valley Children's right now. Community hospital in Fresno was out of network for almost 6 months. So it's just a negotiation tactic to get more money. And we want the carriers, we want Blue Shield to hold strong with Stanford, just we would want Anthem to hold strong with Stanford because they're not asking for a rate decrease in what they pay for. So it's only, any increase is going to be paid on the backs of the insured. So there's continuity of care, so anybody that's in treatment, so if you saw the letter, it gives you the steps of maintaining care. But Stanford, it's a long-winded way to say Stanford. MD Live is also a benefit that we offer. Our benefit is it's a telemedicine benefit. If any of you have used it, it's a great benefit. We've had it in place since 2013. We really saw this benefit skyrocket during COVID, where people just shouldn't have been in the hospital unless they needed to be. It's harder to get into their doctor. This provides our members with 24/7 access to urgent care resources via phone or video at no copay. So we're still maintaining this at no copay. It also expands to behavioral health So therapy, psychiatry, psychology for adults and covered children at no cost. And there's also a dermatology benefit that, is done via, picture, they diagnose and send you the results. Our EAP is an employee assistance program. This is a benefit for anything that bubbles up in a member, employee, a trustee, anything in their household that's going on where you need coping, grief, counseling, guidance, support. The EAP is something available to anyone in your household. That includes counseling sessions, legal assistance, financial assistance. It looks at the person holistically. It goes beyond just counseling. Like, what is the whole picture of why that person needs guidance, care, coping, and whatnot. So that is included in the CBT plans. Delta Dental, we matched over just the plans that you currently have available with the 3 cleans and the calendar maximum of $2,000. One of the benefits with being in CBT is we just bumped up our PPO network amount that you have $2,000 if you have a calendar max, 3 cleans, $2,000 calendar max for any premier Delta Dental dentist, or if you choose a dentist or go to a dentist that is out of network. If you use a PPO dentist in the Delta Dental network, you get an extra $400. We just bumped that up last year. So we encourage the PPO network through Delta Dental because it gives the member the best benefit for their dental care.
So that would, excuse me.
Sure.
That would be $2,400.
Correct. And actually, so coming into CBT, you would start $2,400, and then that is a benefit that renews in January. That is a calendar year benefit. They will not bring over the cleanings, but they will bring over the calendar max. You would start fresh with that.
You mentioned 3 cleans.
We just mapped over what was currently available
We
to
get 3
you.
cleanings now?
Yes.
Yeah. You didn't know that?
Well, they told me only 2, that's fine.
Well,
They gotta look down and you gotta look a little,
Yeah.
the dental office needs to look down at the screen.
I've been paying for that 3rd one.
We've always
I
had
get 3 a year, but I pay.
But no, I didn't know I thought Cisco.
Cisco's, yeah, we have.
Yeah,
we
Cisco
have
has
3.
2.
We have 3.
No, they.
Oh, that's right, that's right.
I've been missing out.
And then another enhancement we made last year is that all preventive care does not come out of that calendar maximum. So exam, cleaning, x-rays, those are covered under the CBT. They don't touch the person's calendar max. So that preserves your benefit for the more expensive crown, root canal, bridges, implants, whatnot.
Implants and all that.
Yeah, so you do get a better benefit when you use a PPO dentist and all your preventive care is covered.
And how often are x-rays allowed?
I don't know, but we follow what CISC is
Whatever it
because
is.
we're all in the school
Because I
pool.
always ask, every time I sit down, they say, do you want x-rays? I go, is it covered?
That's a great answer.
Right.
That's a great question
If it's
too.
covered, you can do it. If it's not, then
Yeah.
don't. So, but they never come back and tell me what the coverage is. They just tell me, well, yeah, it's covered. Nope, it's not covered.
It's I believe it's every 5. A full mouth is 5, I think it's every 2. But it mirrors, our plan mirrors what CISC because we follow the same. All of our CBT, CISC, other large, brokers and JPAs, we all fall under the same school pool for Delta Dental. And that's what Delta is, the premier network for educational business. And then another additional benefit is called SmileWay. So anybody that has any type of chronic condition, there's 20 conditions, diabetes, heart disease, lupus, there's 20. They can go onto the Delta Dental website, sign up for the SmileWay program, and get even more cleanings. So that is an opt-in program. So that's not just your dentist verifying the benefits. You have to actually take action and enroll in SmileWay there. So that encourages, if ever you're told you need 3 cleanings, it might be because you have a heart condition or a health condition where the medical guidelines say you should have more cleanings to connect the oral care with the whole body. The benefits are listed there. So VSP, we are making some changes to the benefits effective October 1, so this would line up with you. We are increasing our frame allowance from $150 to $200 for frames. The contact lens allowance is going from $120 to $150. That also allows the benefit that we put in place for October. If you wear contacts, they'll take away dollars for the fitting. That no longer applies, so the full $150 can go towards materials picking up contacts. We've also partnered with VSP to offer the essential medical eye care. Most people in this room have a plan where their medical coverage covers you have an eye condition, you go to your eye doctor, you pay your $10 or your $20 copay. But some of our members are on plans where they're on our bronze plan, where they may have a $5,000 deductible to meet. This vision benefit, when you use a VSP provider, you can have medical eye care for a $20 office visit or a $20 copay. And then the Premier Edge Advantage, this is another enhancement we've made. So if you go to a Premier Edge provider on the VSP, what you may be going to one now, if you are looking for one, the VSP website, it's very apparent when you Google or you go on the website and you look at the eye practitioners. If they are a Premier Edge provider, your copay goes down to $0. You'll also get a retinal screening at $0. And they offer a wider selection of frames. They have a guarantee or a warranty on your glasses. So if you do not, let's say your prescription changes, you damage your glasses, you don't like your glasses, you have a year warranty to swap out with a $40 processing fee. So that is a benefit that you will come into that starts October 1.
If our current provider is a Premier Max.
Correct. So either your provider is or isn't, but you have the ability, if you want to change, to receive the benefit of, that would be your choice.
Right, you just may have to go out of town because Los Banos is very limited when it comes to eye care.
That may be,
Yeah.
yes, that may be the case. Costco is, I know there's no Costco here, but Costco, Sam's Club, Walmart, they're also in the network. We've upped the frame allowance to from $80 to $110 for that benefit as well. More information on the Premier Edge promise. That's the warranty for the replacement. And then the bottom slide, this is just resources for our districts and our union groups overall. We talked about the EAP. Our staff will come and do flu shot clinics. We participate. Once upon a time before COVID, you had the back to school breakfast that we would participate in, bring our giveaways, bring our vendor partners to come and just provide resources to Anthem. If that comes back, we're happy to sign up and put our name as a partner to support open enrollment events. Through our employee assistance program, we have wellness seminars, financial planning seminars, stress management. There's a catalog of about 200 classes that are available. Biometric screenings. We just entered into a partnership with Quest Diagnostics that they will come on site, and I think CIS kind of paved the way for us to start this benefit where they'll come on and do a venipuncture blood draw, give the member or the employee a screening, and it's actually expanded kidney function, lipid panel, there was one other, A1C, height, weight, blood pressure, with a $25 Amazon gift card. And then we have a well-being, wellness program if the employee groups wanted to form a wellness program for employees. So I might have gone over time allotted, but happy to take any questions or and our contact information is in here if you need.
Is there any way online to look at what I specifically have and then compare it to what this is, so I can compare apples to apples here?
That would be a little challenging because we don't have insight to what CISC makes available to you. But if you told us what plan you were on, so however you got that information from the district office, or you just, told us that, then we could look at the CISC and help you with that.
Is there a phone number I can call to do that?
Yeah, we put our email addresses. You could email, I would say email Anthony, any one of us. We could set up a Calendly appointment, talk through.
Okay.
Our 800 number is here. Rosa's remote, so her cell phone is here. But our office is in Fresno.
Okay.
And any way to reach out to us, we are available.
Thank you.
Any further questions? And if you want to email your prescription questions,
Yeah.
you can email it to me and one of us can do the research
Okay, I'll do
with
it.
that.
Yeah.
And I would extend that to any
If you think of
trustees.
anything when we walk out the door, I mean, you could send an email to all three of us and one of us will jump on it, so, yeah. But
So we're here for you. We hope that this is a good fit for you. We've enjoyed working with Jennifer and the teachers for many years. And, you know, as Mr. Pereira said, we aren't commissioned employees. We are not for profit. We really are here just to serve our member districts. Thank you for having us.
Thank you.
I have a question here on the premium, monthly premium for this. Do we know what that is?
Yep, that is listed on page,
Did I miss that?
Yeah.
on page 5.
This one?
I saw it in that one. Is that here?
it's in both, yeah,
It's in
it's a
both.
bigger, the
Yeah.
quote packet will have all the information bigger than what's on the PowerPoint.
This is the robust.
Oh,
This
okay.
was the
Yeah.
high level,
Yeah.
this is all the details, and this actually might be something, I don't know how CISC distributes their materials, but using this is a little bit deeper. If you
Yeah.
wanted to line up the plan you're considering
Yeah.
to what you have now, if you want to take first or reach out to us, we can help you walk through
Okay, perfect.
those.
And I'll add too that you'll notice that in this packet, so you have, the teachers actually offer 6 plans. So there's a couple more plans, like there's a bronze plan and a wellness plan that it's kind of outside of what the CISC offers. So in the PowerPoint presentation, we compared kind of to where the plans line to CISC, but you'll actually notice there's a few extra plans that are in this packet and rates for those. Really anything anything under that plan 1, that 100% plan, there's gonna be no cost to you. So really, you could look below those, but that plan 1, that's gonna be the top tier, that Cadillac plan, if you will, and that's gonna be the best plan, so, yeah. But again, don't hesitate to email, call, whatever you need, we're here to help, so.
This monthly fee, is that for family or is that for a single individual?
It's for family too.
Wow.
It's called the composite
Yeah.
rate, so whether you, one or.
Any and all,
Five.
yeah. Any and all, yeah.
Any other questions?
So if, I know that the district office reached out to all of us to pay our premiums for the upcoming year. So for those of us who just paid the whole year and said, here's one check to cover the whole year, that doesn't go into effect until October?
Ours, we would start billing the district in September, around the 20th of September for October premium.
So
Like we
if
would be responsible for those first 3 months.
Right.
That's the bill.
Right, so they would just take my check and just reimburse me what they didn't use.
Right.
I would, yes, if you were to choose a plan that fell,
I got you.
yeah.
Because this takes effect October 1st.
Right, gotcha, okay.
Anything else?
Well, thank you for having us.
Thank you.
Okay, thank you very much, we appreciate it.
Very informative.
And Lisa did send us all the rates of what our CISC rates are and what LBTA rates are, which would be our rates. So everybody received that email. So if you want to compare rates,
How long ago was that sent?
Well, they sent us a letter.
it came from Lisa.
You can still, and Mel has copies of those
Yeah.
for both companies, so you can get any.
It's on the district website also.
This is,
All tomorrow.
It's on the district website. Let me see if I can.
but that's not what it was last year. It's double.
Thank you.
Thank you.
Thank you. Bye-bye.
$1,000.
Oh, crap.
That's fine, you can give it, I'll get it later.
It came from Lisa.
That's fine, I'll look for it, I'll
I
look
just
for
know
it.
I've had both, and they're both very comparable. The
Yeah.
only difference is that I'd save $200 a month.
Mhm.
That's big.
It is.
Yeah, $200?
If you do the first plan. I mean, I don't know
You
if
can get a
this,
free one.
but then you have money out of your pocket.
It just depends.
It depends on your need.
Yeah.
It depends on your need. If-
I will take this.
Like if you have something else, I'd probably take zero, but I don't have something else.
I'll take this one right here.
Which one?
I'll take the 238, 236.
But you're right, prescriptions are the only thing that I see is different, and you have a lot, because now I pay zero for my, I mean, I'm only on cholesterol medication, but now it's 5, but that's a big deal.
Well,
I
and,
think
but you
I save money
also,
still.
but you also think that if you would take the difference from your
Right.
monthly cost, which plan one is, I think it's almost $200. Difference between SIS's top plan, CBT's top plan is $200 less. I know when I compared the plan that I was on, it's $268 a month. With SIS, it's zero with CBT.
We got 5% increase next year. That's still pretty much so cheap.
SIS was 9%
9% this year.
Yes,
And
for
then
2025.
Oh,
yeah, that's why it was
how about
so
20,
different.
2025 is still 9%? So there'll be 5% next year.
So did I hear
That's
her,
about 9.
did I hear her correctly when she said that because of the rules, they can't just go from Blue Shield to Blue Shield, so that's why they have to put us on Anthem if we decide to go this direction. But does that mean that after you've been on Anthem for a year, after that you go back to Blue Shield?
No, only if you want to.
So you can stay on Anthem if you want to.
And I have never really seen that big of a difference between Blue Shield and Blue Cross.
The biggest difference is that Anthem has a larger network than Blue Shield, but most of your hospitals and doctors take both.
Take both, right.
So there's cost savings.
It's a big cost savings, from what I see.
So the question is, go through it, know what the question is tonight, and use it.
But I thought some people might want to do more research.
Yeah, we do need to let SIS know. I mean, they have a cutoff date before you can't leave, so that's something to,
What is that date?
Tina checked and they said it was July 1st.
That's historically, July 1st is what they said, but they also said since this is such a small group, that they would take it, they knew that, we were meeting and everything, so.
But CBT said that they needed by like, what did he say, August 10th?
15th
To make,
latest.
to get us our cards in time for the October 1st change. The rates are on the district website. So you can look at those.
The rates are right here, right? I mean,
They have all the rates.
okay.
They have CSEA, they have LBTA, they have unrepresented trustees. So they have all the rates there, so you can do a comparison. But like I said, it's a big chunk of change from what, what we got now to, And like I said, I brought this forward only because there were questions about the big increase in costs. And I said, there's a way to save it. This is one of the ways we can save it. And then, like I said, they're very comparable plans. we haven't heard the teachers complain about their medical insurance. That should be one clue that it's working. And like I said, the monthly savings could offset any other out-of-pocket costs that might be there for prescriptions or whatever. Everybody's situation is different, so something for everybody to look at.
I should ask her, do you know if they take, what do you call it? You call it, if you have like an event change in your life, like you lose your health, will they take you throughout the year? If you have any,
Yeah, she mentioned that.
She did say
She
that?
did mention that.
She did.
She said if you had any life-changing
Life-changing
event, like
events,
had a baby,
Mhm.
or you got married, or you had any kind of a life-changing event, they allow you to jump in and
or you get married again?
get married again.
Yeah? What?
I know we had to talk about this.
We didn't even know you were married.
So,
That's good.
I'm ready. But
it sounds like some people want more information.
so we need to set up another date?
We're gonna have to have another meeting before our October board meeting, probably. I mean, August board meeting, is that?
A great one.
August is the 8th.
Well, she didn't even cover life insurance.
The 8th won't give us enough time? Give us enough?
Well, yeah, it would, I guess, if we can notify everybody.
Too close?
But how long, how much longer is this gonna wait to
You have a
get notified?
$300,000 policy, life insurance for $31.
So, okay, we have, what the district pays $4.25 a month for life insurance for us, or for all the Cisco coverage. It's not included in the premium. It's something that the district just pays for out of that. They listed I saw those back there too, they listed the cost of the premiums for a different amount. I don't even know, how much is that $4.25 coverage? How much?
It's 50,000.
50,000?
For 4 months?
Yeah, the 425.
And then when you first.
It's a life
When
insurance?
you first sign up, they let you like purchase more.
More if you want, yeah.
Right,
Of
when you
course.
first sign up, you can purchase like, I did.
You can get $300,000 for cheap.
So 50,000 is $5.20.
You have to pick that up.
It's my name tag.
Your name. So 50,000 is $5. If we want to, if the district would agree to pay 50,000 life insurance policy, would be $5.20.
Yeah.
I mean, that's something yet to be decided, but
Well, they have pet
hopefully none of
insurance.
us need it.
I wish you had pet insurance,
They
don't
have pet
you?
insurance?
Pet insurance, no, they don't have pet insurance.
See that, okay.
They should, it costs just as much as
Yeah,
people.
people,
Yeah.
So what does that mean? What do we do then on our next letter C?
you might just get pet services through the EAP. Sometimes they'll pay pet costs.
What do we do then with C? We are talking, postpone that
It's up to you guys.
vote, or?
You guys can vote or you can postpone it.
I'm ready, but I'm not gonna push anybody
Yeah,
else
me
to be
neither.
Yeah, me
ready,
neither.
so.
If not everybody's
If
comfortable.
somebody needs more time, I'm absolutely fine with that. But we've researched and we've checked the coverages and we've checked our doctors already, so.
Oh, I trust you guys. I mean, I know they're pretty much relatively trying to make a buck, so trying to cover everything, so.
Yeah, I just would be, I mean,
I just want to make sure they got everything covered. I just know what I just paid to cover us for the whole year. It's a lot more than this dollar amount. Right?
Yes, it is.
But I want to make sure, I want to make sure the coverage is apples to apples.
Gene, yeah, but you should check yourself.
yeah, I don't want to rush Eugene at all.
Yeah.
We'll have to meet again pretty soon then, because the deadline's like
I,
10th, first of August.
I think that you guys want to maybe try to do a special board meeting that last week of July?
I mean, we can.
I can do that week, I can't,
Or
I
like-
can't do next week.
No, not that we can't, the administrators are gone. I don't think
Okay.
Dr. Marshall's available until the 1st of August. So if we did something the week before the board meeting,
Which is,
the
Can we get
1st.
closed, right?
Yeah.
Well, the 1st is better than the 8th. If they're saying that they need to know by the 9th,
Yes.
So the first is on a Thursday.
You want to notify CISC as soon as you can.
I'm sorry?
Notify CISC as soon as you can.
Right.
look on your calendar for the 1st. See if
I'm getting back, yeah,
you're back, because you have anything scheduled that day that you don't remember.
I'm back, I'll be back, so,
You're back.
yeah.
You guys,
So I come back earlier.
does the first
I'm
work
back
for
on-
you
I'm back
guys?
on the 31st, actually.
First works for me.
You know what day is that, Friday?
Thursday's.
are you here on the 31st?
Yeah.
Oh, wait,
Yeah, later, but that, like that morning, I fly back early that
But,
morning.
okay, but what if your flight's
Yes.
delayed?
That's the first one, that's one of the first ones out.
I just want you to not.
So we do something like that, we do something like that.
We'll take it so bad.
I know.
We'll take these joints, no, it's page.
Well, no, I'm all right. I mean, I don't, if you guys are all in unison that you guys want to do this, it won't matter whether I say no or not. I mean, it's a majority rule, so. If you guys are all thinking that this is the best thing to do, then I'm gonna say, okay, it's fine, I'm all right.
I might have to take this one.
It's up to everybody. What do you wanna do?
I don't want to have a special meeting for everyone to come back and everybody say yes and I say no, because I'm probably not gonna say no, not if the coverage pans out the way it sounds like it will, but, so I'm all right,
Yeah,
I'm fine.
that's pretty cheap.
You just need a motion. If
Yeah.
you guys wanna do
I thought
something.
we were asking.
You got the letter, right?
Well,
Are you ready? We're asking for a motion?
if you want, I mean, it's,
You have your letter, right?
Yeah.
Yeah,
Guys,
If you guys are okay with this, you guys are okay with this?
I'm okay with that.
okay, then I move that we approve the change to our health benefit provider.
I second.
all right, we got a motion by Katuso, seconded by Valadeo to change our health provider. Any further discussion? All those in favor?
Aye.
Opposed? It is unanimous, minus one absent. All right,
Put the special board meeting on
we
and,
don't need a special board meeting.
I know, I
All right.
just took it off.
All right, we are adjourned. Thank you all.
Okay, thank you, everybody.